Okay, before I go into the patient's room, I'm gonna check the orders. So we have a newborn assessment that we need to do. I'm gonna go over all of the patient's meds. I'm gonna check the patient's last vitals and gather all of my equipment that I need. Wash my hands. Knocking on the door. Hi, Mom. I'm Caitlin. I'm the nurse that's gonna be doing your newborn's assessment. How are you and baby doing? She tells me that they're doing great. Okay, do you have any questions before we get started? She doesn't. So this is our patient. He was swaddled up. He's nice and warm on a warm table. He's at my height. We're at the appropriate height. So the first thing that I'm starting to assess, just by looking, I can look at his overall appearance. He is pink. He isn't struggling to breathe. He doesn't have any blue lips. Overall, his general appearance looks great. So we're going to get started with his head. Actually, we're going to do vital signs first. So I'm going to do his pulse. I'm just going to listen, and I know that his rate should be between 110 and 160. And then I'm also looking at his respiratory patterns, which we know can be irregular for newborns. And then I would take his temperature axillary and make sure that the probe isn't sticking out or on any clothing so we get an accurate measurement. After vital signs, I'm going to start with his head. So it does look symmetrical. I'm going to start palpating, and I'll feel for his sutures, and they are approximated, so that's good. It's a normal finding. And then I'll also be feeling his fontanelles. His anterior fontanelle is a diamond shape, and then his posterior fontanelle is a triangular. And then I'm also I don't feel any swelling or any signs of hematoma, anything like that. Moving to his eyes, his overall face looks symmetrical. His ears look symmetrical. He's responding to my touch. He's awake now. I'm going to fold in his ears and they go back, so we know that's a normal finding as well. Moving down, I'm going to look at his chest. He's not having any cyanosis. He doesn't look like he's struggling to breathe. His chest looks great. I'm going to palpate his clavicles, and they feel fine. And then while I'm here, I'm also just going to go ahead and assess his palmar reflex. So as I press on his hands, they curl up around my thumb. And I'm also going to go ahead and listen to breath and heart sounds now, just to make sure that we don't hear anything in his lungs. And I already listened to his heart once. And everything sounds normal. And then I'm just going to go ahead and listen to his bowel sounds as well. Okay. And now I'm moving on to his abdomen. So I'm looking at his umbilical cord. It's starting to dry up. It's getting hard, so it's right on track where it should be. I'm also going to go ahead and palpate his pulses, his brachial. They're equal. And then I move on and do his femoral as well, which are also equal. And while I'm doing this, I can assess his reflexes. So when I touch him and pull his arms out, we can see that he goes back to his core, which is a good finding that we want to see. And then moving down to his legs, his tone looks good. We can check his plantar reflex, just putting pressure right here, and then we'll watch his toes curl up around my thumb. And then he's going to have a positive Babinski, hopefully. So we would just check for that. And then his toes would flare out, so that's good. And then we would move on to the genitalia. So obviously this is a boy. I would assess that he has rugae on his scrotal sac. And then I could also palpate his testes and pull them down if if they're up real high and I need to. Let's see. I can also, I'm just gonna go ahead and flip him over. So on the back side, I would look at his spine and I would palpate that and make sure it's going down his back how we want it to be, that it's midline. And then we can also assess his anus at this point. We could spread the baby's butt cheeks and then look and make sure we don't see anything abnormal. Everything looks great. And then we could also check for hip alignment here by making sure the baby's gluteus is the same on both sides and that they're even. So now we can flip him back over, making sure he's comfy. We can do the assessment where he stands like this, and as one leg touches, the other one's gonna rise up, and that would be a normal finding. And then everything looks really great for the baby. Oh, one more thing, I would glove up, and then I would just check that he is he has sucking and gag reflexes by putting my finger into his mouth. And I think that's it. So I would go ahead and swaddle him back up, give him to mom, ask if she's had any problems with him breastfeeding. I would make sure and see if when his last outtake was, if he has had his first bowel movement or urine output yet, and then ask if family needs anything and go document my assessment.